take an intermediate step, okay? And I think they go through this in the book, okay? So Claudine, I need you to help me out here. So I need you to scoot over so that your hips are close to the, there you go, okay? And can you scoot just a little bit upward? Yeah, perfect, okay. Now what I want you to do is get your butt up onto here. So can you sit up? Now of course we're gonna do this only if the patient is uninjured. If they've fallen and they've actually hurt themselves, you gotta leave them where they are, okay? And call 911, get the ambulance, okay? So facing the seat of the chair, okay? Can you hop up onto there? So push and get up from there. And again, facing the seat of the chair, push and hop and get up from there, okay? Now, maybe more difficult than that. Maybe that you need more helpers to do that, but that's the way the book will tell you to do it, okay? So that's how we work with this position, okay? Now, how do we get somebody from a supine position onto the tilt table? You guys know what the tilt table is? What's the tilt table? Why do we use the tilt table? Tilt table is what I call not plan B, but this might be plan B, okay? This is our tilt table, okay? My point with the tilt table is that my patient is unable to get up and get vertical without passing out. Okay, what do we call that condition? That's right, orthostatic hypotension. So our patient has trouble with blood pressure cooling when they're trying to stand up. So I'm going to get them onto a device that, yes, it's plugged in. I just need to find my control. Look at that. Okay? That's what my tilt table does. Okay? Now the thing is, I can stop that tilt at any angle or any degree. So if my patient has a problem with getting into that vertical position, what I can do is I can start them flat, increase to 15 degrees, stop, and take a blood pressure and rest maybe for 5 to 15 minutes, then try another 15 degrees, then another 15 degrees, until I actually get them completely upright. There are different protocols out there for tilt table, but really it gets down to at every degree that you move the patient, whether that's 5 degrees or 15 or just 10 degrees. You need to stop. You need to take that patient's blood pressure to see what's happening. Be sure that their vital signs are stable at that position before you do an extra increase. Now it's boring as heck if all you're going to do is tilt the patient and wait 15 minutes and then tilt them again. Okay, so what do I do? So I can do some arm and leg exercises. I can do my active assisted range of motion. I've been known to play catch with my patient with a weighted ball. So we're doing chest passes, we're doing overhead passes, we're doing underhand. I'm making them lean and catch, okay, while they are in a tilt table position. Okay, so again, if you get therapy, you get therapeutic exercise while you're also moving that patient into a vertical position. Okay, I need a patient up here. I need a patient up here. Claudine, am I gonna keep getting you today? All right, hop on up here, lie down. So how do we get this patient into or out of bed so that we can get them onto the tilt table? Well, I'm gonna transfer my patient from their bed, and I'm gonna take their bed linen along with me, okay? I'm also going to take a cover sheet and cover them over, especially those crazy sneakers, okay? And I'm gonna get them onto my stretcher. We're gonna go for a ride. Guys, when we get to our next unit, which is all about movement and getting patients moving from one place to another, not just one position to another, I'm going to let you go for a ride on a stretcher. Isn't it weird? Be sure that you have a chance to ride on the stretcher as well as be the person doing the pushing. Okay? So what I do is I get my patient ready for transfer is I get my patient lined up with where we're going. I make sure that my brakes are locked. I'm going to put down one and on my railings. Before I do that one, Claudine, what I want you to do is I want you to roll to the side so that I can position my sliding board. So underneath her bed linen, I'm going to position my sliding board halfway. Okay, come on back down. Okay. Now, she's small enough that I can probably do this myself. Okay, but I'm not gonna. What I'm gonna do is I'm gonna get some helpers. Okay? So I need, it's gonna be real easy, we're gonna do this overkill. I need 3 helpers. 1, 3 help, oh, go ahead.
Come on.
We're gonna let the men handle this? Come on.
We got you.
Come on. All right. Here's how we do any kind of 1, 2, or 3 person transfers. This is a dependent transfer. My patient is not doing anything. Okay? My patient is basically dependent here, and all we're doing is we're sliding her from this location to that location. The person who is positioned at the head is in charge, okay? That person is responsible for making sure that the helpers are positioned correctly, that their body mechanics are good, and that they are safe. The person at the head also gives the instructions. So this is what I'm gonna do. Guys, I need one person over here, one person over here. I want one set of hands here and here. Stop. I want the other set of hands here and here. Okay? You're down here at the feet, and you're going to be managing her feet. I'm going to be up at the head. I'm going to manage her head. When I count 3, I want us to take her about halfway. We'll stop. I'll let you guys get off of the tilt table, and then we can take her the rest of the way. Okay? We're going to do this in 2 steps. So, guys, I want you up and on the tilt table. Greg S. had a question.
Are we lifting or are we sliding?
You're just sliding, okay? The sliding board is going to be our helper. When I count 3, we're just going to take her completely onto the sliding board. And then we're going to stop and reposition. I'm looking at Josh. Josh, you're in good shape. I want you to be a little, yeah. Okay? So you are just going to be shifting your weight from this side to this side as we move. Everybody know what they're doing? On the count of 3, back to where your hands were. Greg, yes, I need your hand right here. On 3, just lean back, my guys, okay? Josh, all we're doing is holding straight up in the air, okay? 1, 2, 3, and we're the rest of the way. Okay? Cool? All right. So we can get the stretcher out of the way. I rarely worry about whether or not she's all the way down, okay? Because as soon as I start tilting her, gravity's gonna take over, okay? Now, do you see the, no, you gotta be more careful. Run it through, get your hands outside, good. Now, we could use 3 of these. Inside out. There we go. Gotta know which way the Velcro goes. You could use 3 straps or just 2. Yep.
These are not counted as restraints.
Nope. These are not restraints. Okay. At the minimum, I want one. Go ahead and my helpers can move. Okay, I want one of my straps at knee level. I want the other one just above her hips. Okay? If this were a larger, heavier person, I may also add one underneath the axilla, one at the hip line. Okay? Because here's what we're gonna do. Right? We're gonna take her vital signs, ask her if she's feeling okay. Vital signs are okay. She's been sitting up. Guys, you may not be able to see this. You have to find it first. Let me find it. There it is. Underneath here. Do y'all know what a protractor is? Okay, it's a half round that has the different angles in it. So there's a little protractor in there with a needle. Right now, it's saying 0 degrees. But when I move her in an upward direction, now my little protractor now we're reading 20 degrees. Okay? Feel weird? It feels weird the first time you're doing it, okay? And if there's time in lab and you guys have already done everything that you need to do, you can certainly mess around on here. And also when we're doing our gait training, we can get into this as well, okay? I'm taking her vital signs. I'm checking to see that her blood pressure is not bottoming out. I want to be sure her respirations and her pulse are still okay. We've counted out 10 minutes, 15 minutes, depending on how her vital signs are. And we're ready to go up again. Ready? We're going to do 10 degrees. And now she's going to slide down a little bit. Okay? Because gravity's going to be taking her down just a little bit. And I might loosen up the belt just a little bit just to let her slide. There we go. Okay, so her feet are solidly here. I'm taking my vital signs again. We're counting out 10 minutes, we're counting out 15 minutes, whatever we need to do. Again, this is all about getting her accustomed to an upright position. Somebody who has been in bed for a long time may need something like this if they still feel dizzy when you're trying to get them standing up. You know, you may need to do this.
Is this someone who is in the chart as having orthostatic hypertension? It's not your decision that you hold.
Not necessarily. The This is somebody who has gotten dizzy when we've tried. We've tried on 2 attempts. They still get dizzy and sick. We need another plan. We need plan B. This is plan B, okay? This is plan B. Ready? Okay, so now we're gonna go up again. I'm gonna try for another 10 degrees. Okay? I know it feels like you're almost standing up, doesn't it? This is only 40 degrees, okay? But she's going to feel like she's standing up. Now we've really got the force of gravity pulling her blood towards her feet. We may see a change in her vital signs, so now we've got to monitor her vital signs and leave her in this position until things start straightening out. Okay? And they may or may not. If they do not, this is as far as we go. We got to take her back down. Okay? And we got to try it another day or in the afternoon. You know, however we need to get this patient going. Absolutely, absolutely. I write down the exact steps that I take. So 10 minutes at 15 degrees, 15 minutes at 30 degrees, you know, and so on. So that, Greg, when you do work with her in the afternoon, you know exactly what I did, and you can take over and do the same and try to get additional time and additional height. Yeah.
Is there somewhere we can find your guidelines for where to start out? Is it 20, then 10, then 10?
Actually, it doesn't matter.
No?
The
Oh.
time and the degrees are based on what your patient's vital signs are doing.
Okay.
Okay?
Okay.
So you can start conservatively, but you've got to remember that if the patient has been in bed and the head of the bed has been elevated by 30 degrees, it's probably safe to say that 30 degrees is okay. So
Okay.
that's where we can start.
Okay.
But if the patient has been flat level, I got to start flat level, and I may only start at 10 degrees. See, so it matters. What's different is I'm monitoring her vital signs. Where I start really doesn't matter.
Okay. And what about the shoes? Do you like put their shoes on first if they don't?
Absolutely.
And
I love those shoes on.
and how do you keep the bedding clean that way? Just
I don't care about the bed.
no. Okay.
Because while I have her, I've got her dirty linen on here.
Okay.
The nurses are back there cleaning her bed while
Okay.
we've got her out here. Okay? They love it because we've taken her out of the bed and now it's easy for them to clean up the bed. Okay? And when we're done with treatment, all of this dirty linen goes in the dirty linen basket. No problem. Okay? Good? She's still doing good. We're going to go up to 50 degrees. I know it's going to feel like you're starting to tip over, right? But this is only 50 degrees, 50. She feels like she's upright. She's not there yet. Okay? Once again, in this position, I'm taking her vital signs. Maybe we're exercising. I'm looking for stability. We're keeping her here 10 to 15 minutes. Okay? And let's say that she's ready to go on. Everything is still fine. See? Thumbs up. Here we go. This is 60 degrees. She's going to start feeling like she's tipping forward. That's what she feels like. Okay, but you know that she's very safe where she is. At this position, what I may do with my patient, I may start loosening up the belt just a little bit, and I'll loosen up this one. And what I want you to do is I want you to do a mini squat and push up. See, now I can do some lower extremity exercise. So I can do a little bit of a mini squat. I can allow a little bit more flexibility in here. Now we can get some leg motion because we've been throwing the ball back and forth. We've got plenty of upper body work that we're doing. Okay? Have I ever walked somebody off of this? Yes, I have. Okay, and you can do it. All right, but if I've gotten her to, and this is hanging right around 60. 62, 63 degrees. If I've gotten her this far, she's gonna be fine when we go to stand up. Okay? Wanna feel what it feels like to be all the way up? She's really gonna feel like she's tipping forward, but that's 90 degrees right there. Okay? Yeah? Now, watch this, because this is really gonna freak her out. Right now, we're now returning to supine, and very soon she's gonna feel like she's gonna be tipping backwards. Tell me when you start to feel that way. Yeah, right about now, she feels like her feet are actually higher than her head. Look, it's all about the vestibular system. There's nothing clever about this. There we go, and that's dead level, but again, she's gonna feel like she's tipping over backwards. Yeah.
When you say vitals, you're just talking about blood pressure.
Actually, no, I do blood pressure, pulse, and respirations. I wanna see all of this. I wanna see how is she relatively distressed while we're doing this. And when somebody starts to hyperventilate and their pulse starts to get a little bit crazy, then I know we gotta back down even if their blood pressure is just fine. Okay? Legs over the end, and you can slide on up.
You return motion in one motion.
Oh, no, I stopped along the way. I just did that with Claudine just so that it would feel like she's gonna be tipping over. Okay, so far so good? All right, I need one more person, and it's not Claudine.